Hello to all our friends at Dairy Queen. My name is Dr. Richard Lambert. I'm the Medical Director for the Pediatric ICU and Critical Care Medicine Division here at Janet Weiss Children's Hospital in Danville. We recently had the opportunity to give Gary a tour of the Children's Hospital, and we wanted to share a few of the experiences that he had with you as well. We're going to walk over to our Pediatric ICU. So we're outside the ICU. This is a 14-bed intensive care unit that's part of a 90-bed children's hospital. In this ICU, we take care of children from 2 weeks of age up to 18 years of age. If you're younger than that, you spend time in the neonatal ICU. If you're older than that and you need intensive care, then you go to the adult hospital, What we take care of in the ICU is typically a child that is critically ill or injured and requires ICU services. A typical situation would be somebody that's in a motor vehicle accident, a motorcycle or ATV accident, and given the large rural area around us, there are a number of farm accidents as well that happen. Those children are critically injured and need to come and be cared for in our ICU. In addition, complex surgeries, children with chronic needs, or somebody with a severe infection like pneumonia or meningitis may be in our ICU as well. We're going to go ahead and step inside the ICU, and we're going to see some of the items that your generosity and donations have allowed us to be able to use to take care of these sick children. We are now entering the Kiwanis Heart Center. This is a 2-bed unit. And this is specifically set up to be able to handle the sickest children who undergo heart surgery, either for congenital heart lesions or for acquired heart lesions. They're 2 large open rooms, recently renovated, updated with the most state-of-the-art equipment that we have. And again, this allows us to be able to take care of these very sick children. Our ICU is staffed 24 hours around the clock by pediatric intensivists, as well as pediatric nurses who are specially trained and credentialed to take care of the sickest kids. Now, things like Miracle Treat Day and the GoFund campaigns, those raise money that is instrumental in what we do. Every penny goes to something that is either a piece of equipment or it is some sort of resource for a parent or a family, and it all matters a tremendous amount and allows us to take care of these children. For example, this is a bedside ultrasound machine. Typically these cost anywhere from $20,000 to $50,000 depending on the type of machine. This is something that myself and my colleagues use every day. What we do with this is we use it to place large IVs in central veins and arteries in these critically ill children. We can drain fluid from their chest or abdomen in a very safe way. In the past, this used to have to happen in an operating room. Now we're able to do it at the bedside in the safest manner possible. Sometimes we even use this to place a drain in the sac around a child's heart that will drain fluid off and allow their heart to beat better. So, and just something that is instrumental. We use it every day, and we can't say thank you enough that your donations have allowed us to have this piece of equipment and take care of children the way we're able to. Behind me is a pull-out bed. This might seem like a mundane object, but let me tell you it's not. The worst day in a family's life is when their child is in this ICU. And there's nothing that I can think of that is more difficult than to tell that parent you can't stay with your child. You have to leave them and you can't be at their bedside. This allows them, mom and dad, to stay here 24 hours a day and be with that child as they recover. So it's just a bed, but it makes a huge difference to the families, and we are very, very appreciative that we can do that for the families. And we have them in all 14 of our rooms as well. So in a 2-3 minute video, it's hard to say thank you and help you to understand how much we appreciate everything you do, but we really do. And in fact, we invite you to come down, let us know ahead of time, and we can give you a tour, let you see everything Gary got to see as well. So thank you so much from all of us here at the Janet Weiss Children's Hospital.